Remember that the bones act to resist physical force in the anatomical planes. These anatomical planes are in the x, y, and z axis of the bone. It is these physical forces that provide the internal signals for the bone to grow and become more robust. During any given movement of the body or limb of the body, all of the forces are being placed on the bone, and the ability for the bone to resist these forces is what's seen with the stress-strain curve of the bone. In general, we discuss these forces as being tension, forces parallel to the long axis of the bone, stretching the long axis from the central point, or compression, forces parallel to the long axis of the bone, pushing or pulling toward the center of the long axis. When these forces act in unison, we get a bending moment. This bending moment causes compression or shortening to the compression side of the bone and stretching or lengthening to the tension side of the bone. Additionally, there is a shearing force. Shearing forces occur as a compression and tension force applied transversely to the long axis, either in the x or the z axis. When we have a single point or a single direction of shear force, we get a bending moment that is transverse to the long axis of the bone, not causing either compression or tension, meaning we're not getting lengthening and shortening of the bone, simply bending. Next, we have what's referred to as torsion. Torsion is a rotational force that is a combination of compression and tension along or within two or more of the axis of the bone. Unlike with the other forces, we do not get a distinct bending moment within the bone. What we see is a tangential or an oblique angle forcing spiraling within the bone itself.